The healthcare industry is dynamic, with many factors impacting the delivery of care. One challenge the field faces is expanding and building new facilities. This often dire need means that healthcare and hospital systems need faster, more cost-effective solutions other than traditional construction. Additionally, they won't compromise on ensuring buildings are high quality. That's why many are turning to modular construction. Modular buildings have become an innovative solution and are now used 49% of the time by the industry. Modular makes sense for many applications, including emergency hospitals, clinician practices, clinics, and labs. Modular construction is also highly customizable to fit the requirements of any healthcare facility. Examples include exam, surgical, radiology and delivery rooms, offices, waiting areas, pharmacies, and bathrooms. Healthcare organizations that choose modular realize many advantages. Construction is clean with modular because it happens off-site, so there's minimal disturbance. These buildings offer an easy way to expand temporarily or permanently in much less time than traditional construction. They generate up to 90% less waste and require 60% less energy than the alternative. Healthcare organizations can also reduce the cost burden with leasing and financing options. Modular is versatile, high quality, affordable, and fast.